Good morning. Thank you for joining us. It is a hot day in Savannah for several reasons. As we're experiencing unusually hot weather, we encourage you to stay indoors whenever possible and to stay hydrated. The city has activated our standing plans to protect our colleagues that work outside. Likewise, we expect our working horses to be pulled off the street again today and probably several times during the coming week. COVID-19 cases are spiking in our community. While the number of people tested in Chatham County has increased, so has the percentage of positive tests. If a higher percentage of people are testing positive, that is an indicator that the outbreak is worsening regardless of how many are tested. The increased number of COVID-19 cases has also hit close to home for the city of Savannah. Within the last week, 7 of our city employees, 7 of our friends, our colleagues, our brothers and sisters have been diagnosed with COVID-19, bringing the total number of city employees to 9 during this pandemic. We are still asking you to keep 6 feet between you and others, to wash your hands regularly, and to wear a mask when you are around other people. Our instructions has not changed. We keep the faith, but we follow the science. If you want a COVID-19 test, the Coastal Health District is hosting pop-up testing today and Thursday. You can get tested today until 1 p.m. at Compassion Christian Church, located at 555 Al Henderson Boulevard. You can also get tested on Thursday, July the 2nd, from 9:30 a.m. to 1 o'clock p.m. at the Carver Heights or Carver Village Community Center, located at 905 Colat Street, Colat, C-O-L-L-A-T Street in Carver Village. Yesterday, the testing site at Sally Moo Drive hit capacity in 15 minutes. So please be aware that set schedules are subject to change based on availability. In city business, we are inviting the public to learn more about the Canal District Master Plan by participating in one of 3 virtual meetings. The first Zoom meeting is tomorrow, Wednesday, July the 1st at 2 o'clock p.m. You can find the Zoom link to participate on the city's Facebook page. The other 2 meetings are scheduled for Tuesday, July the 7th at 6 p.m. and Thursday, July the 16th at 10 o'clock a.m. If you're unable to attend one of these virtual meetings, you can call 912-429-3364, 912-429-3364, or email planning@savannahga.gov, planning@savannahga.gov for additional information on how to learn more about the Canal District Master Plan. Yesterday was the last day our search firm accepted applications for the next Savannah City Manager. There were 84 applicants as of last weekend, and we expect to have a final number later today, provided Mr. Monahan does not change his mind. On the state level, I joined 9 other mayors from cities across Georgia asking the Georgia General Assembly to repeal the state's Stand Your Ground law. Under Georgia's Stand Your Ground laws, a person can say that they acted in self-defense and they have no duty to retreat during a confrontation with someone else. And we know that this law has a disproportionate impact on communities of color. Shootings are 11 times more likely to be deemed justified when the shooter is white and the victim is black. Now, let's be clear. If someone has entered your home or your property, they're threatening you or your family, you have the right to protect yourself, your family, and your property. So that's not what this is about. If they enter into my house, it's going to be a problem. But the problem really lies in the law as it's written in the public space. That the law essentially says that you shoot first and ask questions later. There's no duty to retreat. If I could avoid it, then the law should say I have a duty to avoid it. That I should not say, well, I'm standing my ground and we'll just, fight this out in court. It doesn't work like that. So this is not responsible, particularly considering what we are facing across the nation in 2020. I believe that our lawmakers can strike the right balance between protecting persons, family, and property, and vigilantism. And so that's what this is about. We're not trying to take anybody's rights away at all. But I think this is an appropriate time in our nation's history and our state's history to start putting everything on the table and reevaluating. So I urge our state lawmakers to take this issue up when they reconvene in January. Pull the data, discuss it, deliberate, debate it, and look at the law through our current lens. This weekend, we will celebrate Independence Day. City offices will be closed on Friday in observance of the holiday. But this Independence Day will be different. We will not be having fireworks as we usually do. And we are asking people, wherever possible, please, big groups is not the way to go. Also, fireworks. Fireworks are particularly disturbing to me because not only are they dangerous and very difficult for our law enforcement to enforce, but they disrupt neighborhoods and they cause hours of distress for many of our neighbors, particularly our elderly and our children, those suffering with PTSD and other disabilities, and of course our pets. And I will tell you that this goes on late into the night. Our police department receives many calls and can't get to them in time. State law limits the city's ability to regulate fireworks, so unfortunately there's not much we can do at this time. I'm hoping that the Savannah City Council will consider the local regulation of fireworks on our legislative agenda for the next General Assembly session. Currently, state law bans fireworks on roads and highways and within 100 yards of a hospital, nursing home, or gas station. And, according to state law, fireworks are only allowed between 10 a.m. and 11:59 p.m., and we know that is not the case. Savannah Fire also suggests using alternatives for fireworks like glow sticks or red, white, and blue silly string, especially for kids. Fireworks are still combustible. Fireworks are still dangerous. Particularly to me, guns are not an alternative to fireworks. Please do not shoot guns in the air. This is not how you celebrate, and it is not a celebration. It is dangerous and criminal. What goes up must come down. And when you shoot into the air, you cannot control where that bullet lands. Please remember that we're still in a pandemic. Before you plan a big 4th of July party with your friends, family, or neighborhood. I'm not hanging out with too much of anybody this 4th of July. I'll watch it on TV. Finally, this morning, I sent a letter to Governor Brian Kemp informing him of my decision to issue an emergency order to mandate face coverings in the public space in the city of Savannah effective 8:00 a.m. on Wednesday, July the 1st until further notice. This emergency order will be taken up, approved, or modified by the Savannah City Council at our next regularly scheduled meeting. Frankly and honestly, I do not believe that we have any other choice. Let's just look at the facts. Last week, Chatham County had 301 new infections, which is a new record. Last Friday, we were at 999, and we have already far exceeded that. We had a 125% increase in new infections from May to June, which is a new record. Our 7-day rolling average is 43, which is a new record. And our 14-day rolling average is 33, which is a new record. Remember, it was just a few weeks ago, we were planning to move to phase 2 of our Safer City reopening plan. And that goal was 6. And here we are at our 14-day of 33 and our 7-day of 43. The numbers speak for themselves. These are not the records that Savannah wants or needs to break. And this necessitates a substantial paradigm shift and corresponding drastic action to keep Savannah safe during these very delicate times. We believe that this order is complementary and not in conflict with Governor Kemp's order and consistent with our shared desire to keep our citizens safe. We are hoping that as our governor travels throughout the state in the coming days, that he will find the city of Savannah compliant with his desire that we wear masks. Also, as indicated yesterday, this trend is troubling to the governor as he has extended his current orders. Simply put, all persons entering a commercial establishment in the city must wear a face covering or mask while inside the establishment. This does not apply to religious establishments in our city, although most are closed anyway, but face coverings are recommended during religious activity. All restaurants, retail stores, salons, grocery stores, and pharmacies in the city must require their employees to wear a face covering at all times while having face-to-face interactions with the public. Any person who is unable to safely wear a face covering due to age, an underlying health condition, or is unable to remove the mask covering without the assistance of others is exempt from this order. Now, we'll leave it to you to determine how you demonstrate that, either to one of our law enforcement officers or to a judge. Face coverings are not required in personal vehicles. When a person is alone in enclosed spaces during outdoor physical activity, provided that the active person maintains a minimum of 6 feet from other people with whom they do not cohabitate at all times. Face coverings are not required when a person is alone or only with other household members. Face coverings are not required when drinking, eating, or smoking. Face coverings are not required when wearing a face covering causes or aggravates a demonstrated health condition. And again, verification of that may be necessary. Face coverings are not required when wearing a face covering will prevent the receipt of personal services. And face coverings are not required when a person is 10 years of age or younger. Any person who fails to comply with this order shall be guilty of a civil infraction punishable by a fine up to $500 pursuant to Section 3-3015 of the City Code. The entire emergency order will be made shortly after my signing it this morning. As many of you know, I have struggled with this issue for weeks because it's a difficult decision to make, balancing the right of personal freedom with the need for public safety. The right of someone not to be mandated to wear a face covering, but the responsibility of each Savannian and those within our gates to protect our neighbor. Who is our neighbor? Not only the person that lives next door to us or in our community, but it's also that daycare professional, that teacher, that grocery store clerk, that cab bus driver, that city employee, that Uber driver, that hotel clerk, that member of the media, that reporter, that server. We are our own neighbors. And as I've stated before, my mask does not protect me. My mask protects you. So I need you to wear your mask to protect me, because I care enough about you to wear a mask to protect you. Let's be very clear, and I'm glad to see Alderman Nick Palumbo has joined us. The purpose of this order is compliance, not punishment. Our intention is long-term progress, not short-term pleasure. Before we cite you, we will offer you a face covering. So again, this is not to be punitive. We will offer you a face covering. If you refuse to wear it and can't demonstrate a reason why you shouldn't wear it, that's a different issue altogether. We have witnessed tours of various means and modes all across our city, and I'm asking our tour operators and those in our hospitality industry, we need your help to insist absolutely in the wearing of face coverings. No face coverings, no service. And I'm asking our visitors, our guests, to understand where we are coming from. You're coming to our city. We are giving you our very best. We're giving you the best in hospitality. We're giving you the best in history. We're giving you the best in food. We're giving you the best in beverages. We're giving you the best in service. We're giving you this from the best city in the world. We pride ourselves on being the hospitality city, the hostess city of the South. We pride ourselves on being excellent hosts. The least you can do for your gracious host is to proactively take measures to protect us after you have left us. And many of our visitors know they're coming from places where masks are currently mandatory. So they get it. Just understand we're just trying to be safe so you can come back and visit us again soon. I'm very glad and pleased to have with us this morning Dr. Erica Russell Petty, a Savannah physician and a new president of the Georgia State Medical Association, who I now invite to share her thoughts on the topic. And because she has really schooled me on this, I'm going to clean all this up for her, because she's made it clear that I may not be cleaning well enough. So before she comes up, I'm going to make sure that I appropriately prepare our podium, because you follow doctor's advice, right? So I'm going to take care of this right quick. So. Dr. Petty.
Thank you, Mayor Johnson. Good morning. I thank God and I thank you, Mayor Johnson, for this opportunity. I am Dr. Erica Russell Petty, a pediatrician here in Savannah for over 20 years, and I'm the current president of the Georgia State Medical Association. Over the course of the COVID pandemic, I have had numerous calls with local physicians, state physicians, and other physicians throughout the country. We have seen the surge of cases of COVID-19 across the state and country seem initially to improve in those areas where COVID-19 first surfaced. However, in many of the areas where people were not initially infected, the number of positive cases is now climbing exponentially. This increase in cases follows the science, which predicts that the more people who are exposed to COVID-19, the more people infected, and consequently, the more people who have already had to and will die. Unfortunately, those who have limited access to medical care are the ones who have an even greater risk of dying from COVID-19. Locally, we are also seeing more young people with no pre-existing conditions having to be admitted to the hospital. We, the physicians and other medical professionals, would like to minimize the number of those infected and hopefully minimize the number of deaths associated with COVID-19. We therefore agree with the CDC, Dr. Fauci, the Surgeon General, Dr. Jerome Adams, and the scientific methodology that supports wearing some type of face covering to help limit the spread of COVID-19. We therefore fully support Mayor Van Johnson's emergency order, and his order is consistent with the science as we currently understand it. Other important measures to help limit the spread of COVID-19 are that you avoid crowds, wash your hands, whenever possible, avoid any gatherings and maintain social distance from anyone who does not live in your home. And avoid enclosed areas where someone may be infected. As you know, they may be asymptomatic. We also want to give some guidance on what to do if exposed to COVID-19. You do not need to immediately get tested. Try to wait 10 days, because if you test sooner and have a negative result, you will likely need to be retested to ensure that you are negative. Currently, we still have limited numbers of tests. You should, if possible, self-quarantine at home. If you develop any symptoms before 10 days, you should then go and get tested. Around the 10th day after your exposure, even if you do not have symptoms, go get tested. You should still go outside to get exposure to the sun, but avoid contact with others. Last, we want you to know that if you are called by the health department because you are positive or someone you were around tested positive, they will not ask your insurance information, social security number, or any type of financial information. They will ask your name and birth date and basic information to be sure that they have the right person. So beware of scammers. Avoiding telling the health department worker about your contacts only puts your contact and others they have contacted at greater risk. That can mean life or death for any of those contacts. We do understand that this pandemic has changed everything that we thought was our normal life. But science shows, and it has been proven in other parts of the world, that the best way to regain some normalcy is to wear face coverings to help protect yourself, protect your friends, and protect your family. So please, each of us do our small part to protect one another. Thank you. And this is Dr. Alfred Gorman, who is the Vice President of the South Atlantic Medical Association, our local association here in Savannah.
Thank you so much, and For us, the good news is that the president of the Georgia State Medical Association is right here in Savannah, so we're honored, and that your leadership is playing out on our state stage. We are Savannah Strong because we show Savannah love. And for the coming days, Savannah love means wearing face coverings. Those are my prepared remarks, and I'll entertain any questions. Dr. Petty is also available, and while you're queuing up, I will go ahead and sign this order. Time is 10:32 a.m. So ordered. Any questions? Oh, thank you. Thank you, Alderman Palumbo. I appreciate that. Wasn't expecting the applause, but hey, we'll take it. But thank you. I think it's important. As many of you know, we talked about this last Monday during our City Council COVID briefing. So I definitely appreciate the support of the City Council in supporting this, but I think they could tell you as well. I mean, they're seeing what we're seeing, and they're in the neighborhoods, and they're among communities, and we're all receiving calls from businesses. Someone says, oh, this restaurant had to close down, or this church had to close down, or somebody here is sick. What do we do? And people are getting frantic. And so we have to do something. We cannot just sit by and just let this happen and say, oh, well, there's nothing we can do. We just can't. I mean, and we're not going to do that. We refuse to do that. This is our opportunity to do something substantive, to be able to support our governor. And I think Savannah will be the better, the healthier, and the safer because of it. Any questions? Sean is first. Okay. That's a change.
Thank you. And I do want to begin by asking again if you would mind going over the bounds of the ordinance, where it applies, in terms of where people will be required to wear masks. I know it's public spaces, but then you listed a few others, yeah?
So you want me to review it?
If you would mind. Sure.
I want to read it just to make sure I'm remaining consistent. All persons entering a commercial establishment, which does not apply to religious establishments, all restaurants, retail stores, salons, grocery stores, and pharmacies in the city of Savannah.
Thank you, sir. And with regard to visitors coming in town, you mentioned the holiday weekend coming up. What message is being communicated with our hotels for visitors coming in to let them know that this is now in place?
It is now in place starting tomorrow at 8 o'clock in the morning. We will make sure that through our networks it's widely distributed, and we expect that they will inform their guests as well.
Thank you. And just one more thing for me at the moment. You had voiced your support for the opening of the Savannah banana season, which is tomorrow. Do you maintain that support and for their operation as we get started?
I'm throwing the first pitch. I think that the Savannah Bananas, they've been in contact with Dr. Davis at the health department. He's reviewed their plans. I was out there a week ago for the Fellowship of Christian Athletes. They had an all-star game. They drastically reduced their capacity. While I throw this first pitch, I'm gonna have a mask on. And I'm insisting that everyone out there tomorrow also have a mask on. Obviously, the players would be exempt of that. I think the question is whether I'll have heat stroke from trying to throw this ball in this heat with a mask on, but I'm going to try to do it. But yeah, we're familiar, and as long as the health district is cool with it, we're cool with it as well. It's coming down.
Good morning, Mr. Mayor.
Good morning. Pressing on.
Okay, good. So we've had obviously a lot of bars, a lot of restaurants closed down. And I'm sure the city has been, working with them. Now that the mask mandate, is coming into play, is that something they've been asking for, and do you anticipate them, some of them opening back up because of this?
I believe so. I believe that many bars, they want the same thing, because the last thing they want is to have to close because of a COVID infection. It's bad business for them. Their name is out in the street, and so they want to be able to try to do things in a safe way. And I think that the science is pretty clear that, as Dr. Petty alluded to, our infections are now younger, and they are what they're called super spreaders. These are our invincible young people that can leap tall buildings in a single bound. They're healthy. They will get infected, and it just kind of passes through them. They don't get as sick. But in the meantime, because they are so mobile, they are literally coming in contact with everybody, coming in contact with their parents and their grandparents and people that they say they love. So could you imagine a bunch of these super spreaders now in the same space, in a club, in a bar, drinking alcohol when your judgment now might be somewhat impaired, dancing, doing things in close proximity? I think that bars and restaurants should welcome this. And we will be out this weekend and this week checking to make sure. And as you know, I'll be out there as well. Again, this is so serious that we will not hesitate to cite or shut down businesses that are not complying. You have the right as a business to determine who comes into your establishment. For years, we've always heard no shirt, no shoes, no service. And people got it, they understood it. Now the addendum to that is no shirt, no shoes, no mask, no service. That's how Clarion called.
And the mask issue seems to have somehow become political. And obviously you're citing science and everything like that. So has there been any kind of pushback from city leaders or surrounding municipalities that you disagree or anything like that?
I'm not concerned about the municipalities. With all due respect. I don't live there. I'm not elected there. I'm not charged to do that. Every municipality has to make its own decision about what works best for them. And so I don't criticize anyone who chooses to do differently or do nothing at all. I don't think we do this for the political reason. We do this because we're charged with keeping people safe. If you look to our neighbors just to the north at Hilton Head and Beaufort, they've also now moved to face coverings and masks. Is it right for someone to live in Beaufort or Hilton Head and wear face coverings where they live, but then come to Savannah and be able to take them off? Our communities are in such close proximity that really, we spread back and forth. I'm sure some of that community spread has happened because we're really within miles of each other. So I think for me, it's not a political matter. People will say what they want to about that. It is what it is. I think the science clearly indicates this is the way to go. The CDC clearly indicates it's the way to go. And as I said before, people can be mad at me. They have the right to be mad. They have the right. I'm upset about it too. But I would rather them be well to fuss at me and complain to me rather than being in a hospital on a ventilator where they can't fuss and complain. So.
And then the last question was just more of a review on the penalty. You had said it was a civil infraction if
Yes.
you're cited, and it could be up to $500.
Not more than $500.
Okay.
So again, that'll be something that the legal folks will work out. But again, we're taking this extremely seriously. It's also consistent with what our neighbors are doing as well. And so we want people to take this very seriously. You know, if you have asthma or if you have a respiratory ailment, you probably don't need to be out in the first place. And if you are, then you probably should be wearing a face covering anyway, just to protect you from what's out there, which means you're more susceptible to those types of ailments. So again, you know, we're not going to make this political. We're going to keep it consistent with the science and consistent with the responsibility that government has to protect people. Thank you.
Who will be on the street enforcing the $500 penalty?
Well, not enforcing the penalty, enforcing the emergency order. That will be our law enforcement officers and our marshals.
Additionally, you mentioned possibly shutting down businesses who are not in compliance. What about the businesses who have customers come in and refuse to put on masks? What advice would you give to them?
No mask, no service.
What if they have someone who will not leave? Call the police?
I mean, at that point, it's trespassing.
Yeah.
I mean, think about it. When you came into City Hall, your temperature was taken, and you were required to wear a mask. If you said, I don't want to wear a mask, then guess what? You got to leave. And if you don't want to leave, then Sergeant Gray will help you to leave. And so again, I mean, to us, it's just that simple. We're protecting our employees in here. We have that responsibility. Businesses have the right to and responsibility to protect their employees. And again, we've heard from employees calling from businesses all over the place. Again, they're concerned because one of their coworkers is sick, or a customer came in and come to find out the customer is sick. Again, you know, this is not comfortable, but it's necessary. Thank you.
Good morning, Mr. Mayor.
Good morning, Ms. Emma. How are you?
Good, how are you?
All right.
A couple of questions for you, and I apologize if I missed this. How long is this emergency order supposed to last as of right now?
As of right now, it's until further notice. I think we stipulated that, and it's somewhere on the order. I can't. I believe it's until further notice. And again, that will be when the emergent conditions no longer exist. I think obviously when we stop zooming up the number scale of infections, I think, you know, we can then relax it. But again, that will be based on the medical advice that we receive from not only our coastal health district, but also from our physicians locally, to say, okay, we can take our foot off the brake right now. So.
And I know a big part of this, and maybe this is why it took a little while, is that you were working with the city attorney as far as the legality of it and everything. Do you expect any legal challenges for this order?
I don't know. You know, people are welcome in America to do what they like. And, you know, we support people's right to disagree. If there's an issue and they want to take us to court, then we'll be able to address it in court. The interesting thing about that, though, is that when you go into the courthouses here, you have to wear a mask by judicial order. So that would be pretty interesting to see, you know. I mean, I would like to see it, but, you know, I think we're on good legal standing. Again, this is complimentary to our governor. You know, we're not mad at anybody. We're just trying to keep Savannah safe, and that's where we are in this case in time. I believe that if the emergent circumstances and conditions did not exist, the governor would not have extended the orders, which he's done. You know, so he's getting the same information that we're getting, and so you know, we're standing beside him on this, and we're just trying to keep our folks safe.
And this is kind of a degree question about emergency order, but does wearing a mask also apply to those who are exercising?
Item 4B says when a person is doing outdoor physical activity, providing the active person maintains a minimum of 6 feet from other people from whom they do not cohabitate at all times.
My last question for you. I know last week when I asked you if any other municipality in Georgia had enacted to require masks, you had said that no, and that we could be the leader in this. Is that still true? Do you know?
I believe we're the first.
So how does that make you feel?
I hadn't thought about it, to be honest with you. Again, I delayed this as long as I possibly could. You know, I think, you know, in historical context, Savannah is Georgia's first city. We're Georgia's mother city. We are the nurturer. We're the provider and protector. So, I mean, maybe it might be apropos that that Savannah's mother is leading that way in that regard. We did this to keep people safe. We did it to keep our citizens safe. Our citizens deserve our very best efforts based on the very best science, and based on our very best knowledge to be able to keep them safe. And so, you know, we'll be out, and I'll probably go out and over a couple of days, and I'll probably be walking up and down River Street and other places offering people masks.
Thank you, sir.
Thank you.
This may be a question for the physicians in the room, but in terms of forecasting for the next 2 weeks and infection rates, what are you kind of expecting? What are you looking at?
You can do it from there if you like. You can do it from there if you like.
Over the next couple weeks from what we are currently seeing, it's really not able to completely predict. All we see is that the rates are consistently climbing. So our hospitals locally are seeing the numbers consistently jump. The problem is that as people are not wearing face masks, the number of possible exposures, so it depends upon what establishment they enter and how many other people are there that could then possibly come in contact with anything that person has contact. So there's no way to predict that unless they're wearing face masks. Then we can begin to decrease the amount of droplets that are being sprayed and the amount of potential people who would then be infected. So currently the way we're going, it will be exponential. With this emergency declaration, we anticipate and hope and pray that we will quickly begin to decrease that.
And you had mentioned, and Mayor Van Johnson did as well, about the younger demographic being a large part of the people who are infected right now. Do you have any figures on that? And can you just kind of reiterate that for people watching at home?
I don't have the numbers. I do have the numbers, but not right up here with me. The actual numbers of the youth. Those numbers are available on the Coastal Health District website. As far as the number of youth that are currently being affected in our area, I do know that in our hospitals that we are seeing a larger number of youth actually having to be put in the hospital because of COVID-19, and those youth do not have any pre-existing conditions.
I think the other thing that is noteworthy is this. We're playing a dangerous game of cat and mouse. The reality is that the mouse is COVID-19. We're chasing it. We haven't caught up with it. And the fact is, the more that it spreads, the harder it is for us to catch up with it. And so for us, the mask, the face coverings become the equalizer of sorts. It slows the disease down, the virus down enough for us to catch up with it. And so if we're able to stop the exponential spread of it, we're able now to be able to, this mitigation helps us to catch up with it and then be able to get in front of it. And where we were when the city manager and I, we were talking about being at 6 for us to go to phase 2. I think, Mr. Manager, we were like really within like 2 days of moving to phase 2 of our safer services. And now this thing has grown just as quick. Again, check last Friday, we were at 999 cases across the state of Georgia. 999. And look at where we are today. So we have to slow it down. so we're able to catch up. If we're able to keep people healthy, then we're able to isolate it and localize it. The problem, I think, with a lot of young people is that they move around so quickly, the contact tracing is almost impossible. Who are you around? Everybody. You know, I was on River Street, I was here, I was in this club, I was in this restaurant, I was at my friend's house, I was this. And so then when you look at who they infected, and then, you know, everybody, it's like, I was growing up, there used to be a movie called like Night of the Living Dead. And so what ended up happening was the people would go and they would infect people, and then they infect people, and they infect people, and they infect people. So the goal is to stop people from being infected. So that's all this is. Slow it down so we can catch up. Once we catch up, we can overtake it. And so states like New York and New Jersey have done a great job of not only catching up, and they did masks very early in the game. Very early they mandated masks, but they not only have they caught up, they've overtaken it. And you look at their numbers, and they've dropped while ours are going up. Anything else? Ms. Manager, anything? Okay, well, again, we appreciate you all helping us to get the word out. This is serious, this is real, this is now, this is Savannah. This will be Savannah for a little while. But we will get through this. We just have to change the way we do business. And so this is where we find ourselves on the last day of June of 2020. So, thank you. And for all of